There is a blood that sights the blind.
Hello everyone, Orlan here, your guide and assistant in your business English learning journey. Today we are diving in the world of a clinical nurse manager who's in charge of a phlebotomy department. Yes, I know, lots of big words in less than 1 minute. Rest assured, by the end of this video, everything will be crystal clear. Well, I hope so. To reach that goal, first we will look at some definitions. Then we will listen to the list of duties a clinical nurse manager has to perform. Afterwards, we will look at the hospital organization in relation to this position, the clinical nurse manager. Then we will pay attention to the education, training one can get to reach that position. And finally, we will listen to the skills a good nurse, clinical nurse, need to have to perform their role well. In order to produce this video, I interviewed a clinical nurse manager on her lunch break. Therefore, you will hear some background noise, but hopefully it won't affect too much the quality of this audio. It is important to remember that this person started as a phlebotomist nurse and she still performs this task even as a manager. So I think it is important also to clarify this term first. Phlebotomy is the process of making a puncture in a vein, usually in the arm, with a needle for the purpose of drawing blood. In other words, the phlebotomist nurse is the person that you go to when you have a blood test to be done. What are the main duties of a clinical nurse manager in charge of a department of phlebotomy? Well, let's listen to her own answers.
Assessing, evaluating and implementing policies and procedures constantly of staff and patients and the effective, efficient and safe way of the department will run. So you're always assessing, reassessing. Is this procedure working correctly? Is the safety of the patient and my staff, and me obviously, and support. You have to make sure that everybody is supported. And also, and holidays are important, making sure I have to do their holidays to ensure that they remain healthy so that they come into work. So staff well-being is as important as patient well-being.
So if we recap, you're responsible for health and safety of patients and your staff. Part of your job is to teach, mentoring students, interview new employees, and
exactly,
and put into place
policies,
design policies and procedures. Would that be covering everything you do?
Yeah,
if I say just that.
We see. So the daily procedures, so ensuring that the blood's liaising with various departments, such as the laboratory, the pharmacy.
In short, a clinical nurse manager has to make sure that all patients are safe and well looked after in the hospital, and also staff members are also safe in the hospital. Then a clinical nurse manager train students. They also take part in the recruitment of new staff members. They also take part in the design, the assessment and implementation of policies and procedures. Finally, they have to collaborate with other departments. Consequently, let's listen to the clinical nurse manager explaining how this collaboration takes place and how the staff member roles are organized within the hospital.
I have my own line manager who is my boss. I have my director of nursing who's the overall boss of the hospital. We have the CEO, which is involved for everything, but we've got a director of nursing who is a nurse, who started off as a nurse and then went up the ranks. So he's only over the nurses. The CEO is over all of the departments of the hospital. Then the director of nursing, who's over really the nursing, all nursing. Then my line manager is called the assistant director of nursing, whom I report to. And he supports me. Then you've got the clinical nurse managers and then the nurses. So I'm a clinical nurse manager. We've also got for terminology that's TLNs, which are team liaison nurses who would work with the consultants in the hospital. So each hospital, each ward has a different consultant, or there's various consultants that specialise in certain areas. And so you've got the consultant, but they also have what's called now, that came about over the years, developed over the years, team liaison nurses who work closely with their consultant to, again, ensure that the patient's needs are taken care of. So I also deal with the team liaison nurses as well as the doctors. So I'm always liaising with the doctors, with the team. I also do talks with the doctors when they come in. The registrars, they're called registrars. You've got a consultant who's the head, and then registrars, REGISTRARS, registrars. So registrar, senior registrar, consultants. They're all doctors. They have to be doctors. So you have them. Then with nurses, you have your nurse, you have your senior nurse, then you get senior nurse, clinical nurse manager 1, CNM 1, clinical nurse manager 2. You can have a clinical nurse manager 3, but that will be specific. Say, then you have assistant director of nursing, ADON. And then you have Director of Nursing, DON. So Assistant Director of Nursing and then Director of Nursing, DON.
I hope all of this makes sense to you. If not, let me know in the comment section. I'll do my best to clarify any unclear point. Also, I created this organigram to help you understand better this big organization. Now, let's proceed with the training and education that are required to be a nurse. I just would like to add that the clinical nurse manager that I interviewed had more than 15 years of experience when she first applied for the position, just to let you know. Now let's listen to her explaining the basic training for a nurse.
You also have we're also involved in the School of Nursing, which is how I teach the students. That with the School of Nursing, and then nurses can also go into teaching, go into nurse tutoring, so you've got nurse tutors as well. They would have started off like me, a nurse, and then I think I'd love to go into teaching. So they have specifically to train in that area, and then they teach the students the anatomy, physiology. So when I went to train, I did 3 years training, and then what you would do then is you staff them to be a staff nurse then.
Is there a time where you were studying and at the same time you had to
work, to go on the wards,
yeah,
to learn.
To learn.
Yeah, that's so important. Otherwise you won't learn.
Internship?
No, to be an intern is your final year. Interns are student nurses that are in their final year. They're called interns. They're in their final year of nursing, or 4th year. No, they're still considered students. They're student interns. They're not fully qualified.
Do they have a certain amount of hours that they have to do in a hospital?
They all of them have to come to a hospital. When you're studying nursing, you always have to come to a hospital.
Throughout all the years?
Yeah, absolutely. You have to. It's practical. You can't just learn about nursing sitting in you're dealing with people and human conditions.
Yeah.
So the only way you can learn about medical conditions is by being on the ward, seeing a person that has that condition. So you have to, from the get-go in the hospital. Oh, it has to. That's absolutely they have to be. Absolutely they have to be. You can't possibly learn about anything medically or surgically or anybody who's, unless you actually see the person. It's a human-based It's humanities.
So, 4 good years of studies, and from the get-go, you are working in the hospital to learn your craft the best way. Now, what are the basic skills a good nurse need to have?
From my point of view, the way I train, the basics of nursing is about caring and kindness and compassion. And if you don't have those qualities, as far as I'm concerned, be it a nurse or a doctor, no business being a nurse or a doctor.
Now you know you have to be caring, kind,
Compassionate.
to be a great nurse. But what does a phlebotomist nurse do? I will answer this question in the second episode. Yes, so stay tuned and watch out for the next episode coming very soon. I designed this first episode to help you practice your listening and comprehension skills. I also use this video to demonstrate how I can help you with your business English issues. Depending on the sector that you are working in, I can help you identify the terminology that you need to know and to use and pronounce properly in the right context. So if you want to know more about this service, please contact me at arlaneaed23@gmail.com or leave me a comment below this video. Thank you very much for watching. Until next time, have a very good one. Mind yourself and bye for now.